I am Marie Courbebaisse from the European Georges Pompidou Hospital in Paris, France. The purpose of this podcast is to highlight our recently published article entitled Tubular Acidification Defect in Adults with Sickle Cell Disease. It was previously reported that metabolic acidosis is highly prevalent in sickle cell disease patients. The aim of our study was to determine the underlying mechanism of this kidney disorder. To answer this question, we used an acute urine acidification test combining simultaneous furosemide and fludrocortisone oral administration. This test aims at exploring the capacity of the distal tubule to acidify urine. 25 adults with sickle cell disease with an estimated GFR above 60 were included. Among them, 13 had an abnormal response to the test and consequently an impaired urine acidification capacity of distal tubular origin. Patients with an abnormal response had normal plasma aldosterone levels, excluding a type 4 tubular acidosis. Compared to patients with a normal response, patients with an abnormal response were older, had lower GFR, lower baseline plasma bicarbonate levels, higher fasting urinary pH, and lower fasting urinary ammonium excretion. They also had higher hemolysis activity and lower fasting urine osmolality. Of note, all the patients with an abnormal response to the test had a fasting urine osmolality below 391 milliosmoles per kilograms of water. Our results are consistent with the hypothesis that sustained hemolytic activity in sickle cell disease patients could result in medullary ischemia, which can lead to distal nephron dysfunction resulting in subsequent hypostenuria and metabolic acidosis. In conclusion, we show that among adults with sickle cell disease, impaired urinary acidification capacity attributable to distal tubular dysfunction is a frequent finding and is associated with the severity of hypostenuria. Metabolic acidosis may have severe consequences, such as bone demineralization, accelerated decline in kidney function, and an increased risk of sickle cell disease complications. Further studies will be needed to identify therapeutic interventions to reduce the consequences of chronic metabolic acidosis in sickle cell disease patients. Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.